Hey, there's Dr. Brian McKay, Core Health and Darien. Today, I want to talk to you again about headaches, but this is a little bit different. This is it's like a unique headache. It's actually a very unique way to treat headaches, and I'll give you a little bit rundown on how it all works and how it came about. I was doing a little bit of homework. I hate to call it research. It's not like I'm out there every day, my head in the books, but I do my homework. And what I came across a doctor who was treating migraines with he would dip a long Q-tip, kind of the same thing you would see these people are doing for testing for the COVID, where they go deep into the nostril. And what he would do is he would dip the tip of it in cocaine, and I know it's like, okay, haha, but it really was for medicinal purposes. So it wasn't like a it's serious. It's not like he's not doing it for drug purposes. It was more. And what he was doing was he would dip the tip of it in cocaine and put it inside the nostril to affect an area called the sphenopalatine ganglion. Easier to just say SPG. It stands for the sphenoid bone, and the palatine ganglion. And ganglion is a nerve bundle. And this particular nerve bundle is a branch of the trigeminal nerve. The trigeminal nerve, I think most doctors will agree, has a lot to do with the with migraine headaches. Trigeminal nerve has been shown for a long period of time, and the guy was getting some, quoting him as anecdotally, as is my work with this anecdotally, because as a solo practitioner, you're not going to really have a chance to do studies and get grants, and also too is if there's really no drug manufacturer going to really, I guess they could come up with a cocaine, synthetic to do it if it really worked for them, but it didn't pick up steam. But what it led me to do is it led me to start experimenting with the use of laser as an intranasal laser. And the intranasal laser is just kind of like that Q-tip that you see people getting with the COVID test inserted into the nostril. Now, it's not for everyone, and it's not a painful treatment. Other than it's a little uncomfortable having it like a almost a pencil stuck up your nose, but it's really not it's not invasive. It's not overly uncomfortable, and it only takes about maybe 4 minutes tops. And what it does is it gives that nerve energy to the sphenopalatine ganglion, so it's kind of like a direct feedback to the trigeminal nerve back into the brain. And so I started experimenting with it with a couple patients who agreed to, and I tell you, for those patients, it worked wonders. I mean, it really was a very, very different treatment. Um, and you get relief from migraine, because I enjoy treating headaches because it's still a challenge. So as I mentioned, I'm a chiropractor. People, oh, do you go to a chiropractor for headaches? If you have headaches and not getting any better, yeah, I think you should go see a chiropractor. But this is a little break, because we're not adjusting the spine. We're just, with this particular technique, we're affecting the nerve, at where the nerve it lies behind, up in the nostril area. It's actually one of those areas that is affected by COVID, when you that loss of sense of the smell. So you're right in that same vicinity. There's a lot of nerves. These nerves are probably the nerves closest to the surface, the sphenopalatine ganglion. So it's really an interesting concept, and it works for some people. There's a couple tests I do to determine if it's more, if it's likely to really affect the change for that particular person. So when that's positive, we give it a try, it's one of those things. Is it new? Yes. Is it out there? Are other people doing it? I'm not really sure if anybody else is doing it, but it's another tool in the arsenal to change headaches. And quite honestly, I think chiropractic care, you throw in different modalities. I mean, massage is going to help for sure. I don't know enough about acupuncture, but I believe in acupuncture. Anything that's been around for thousands of years, validity, I trust its validity. So what I'd encourage you to do is, if you do have headaches, give us a call. I mean, especially if you're in the Fairfield County area of Connecticut. I mean, even up in Westchester, because you'd be surprised at how headaches can get resolved with, and then let's switch over, not just laser, the intranasal laser treatment, but also the fact that the brain stem comes down into the top two vertebrae. Okay, so the base of the brain is there. Now, quite often, almost you're going to see tension in that area, and you can imagine tension on the brain stem. Could that cause headaches? Hell yeah. So the idea here is, you have different. You don't have to suffer. I mean, do you really think a $5,000 a month Botox injection is really going to nail a headache? Well, I mean, and your insurance company's going to pay for it. I mean, I wish I had the nerve to charge $60,000 a year to a treatment, but I don't. Um, but the idea is, if you're really serious about headache relief, give a chiropractor a call. As a matter of fact, if you're not in my drawing area, give me a call and I will help you find one. Headache relief, just think of the quality of your life. Not only will you sleep better, you'll perform better, you'll benefit more from rest. You won't be as moody. You won't be as stressed out because you have a physical stress making adding to your mental stress. It's no way to start your day. Um, headache managing headaches with so I get the headache, I take the pill. Get the headache, I take the pill. It's kind of you're chasing your tail. Are you really going to get to the root cause of it? I don't think so. I mean, if you do, great. I mean, then you don't have to listen. Turn this thing off and or downvote it. But the idea here is look outside the box. Medicine isn't going to cure everything. We need medicines for a lot of things, but you have to admit we're an over medicated society. Just because you take cholesterol medication doesn't mean you're healthy. Just because you take high blood pressure medicine doesn't mean you're healthy. Just because you take anxiety medication doesn't mean you're healthy. It's a way to limp along in life. Now, people need these things. I'm not poo-pooing that part. But what I want to say to you is seek alternatives for your headaches if you're not happy with the results. If you get reoccurring headaches, then something is drastically wrong. I suggest you call a chiropractor. Call me, 203-656-3636. 203-656-3636. All right, I'm Dr. Brian McKay, Core Health and Darien. Got questions on headaches? Give me a shout. Have a great day and talk to you soon.